Hello, ladies and gentlemen of Brookdale. I am excited to talk to you today. My name is Ashleigh Thompson, and I am a clinical pharmacist. I work at the Veterans Hospital, the VA, in Memphis, Tennessee. It's in downtown Memphis. And so I have the privilege of working with people that have served our country, all of our veterans. Some of them have served in wars, some not, but all of them have made sacrifices for us and our country, and so I'm super excited to work with them. I work with people with medications, some of those having diabetes. And the way that I heard about you guys is your activities director, Dale Smith, is my Aunt Dale. So that's what I know her as. She's my aunt. I am her niece. And I was actually raised in Reedsville, right there near you guys in Eden, until I was about 13, and then my family moved to Tennessee. So I'm just excited to talk to y'all today. We're going to talk about medications like I do with my patients at the VA in Memphis. So I'm going to put my glasses on, otherwise I will not be able to see my notes that I wrote to talk to you guys about today. So I understand that the ones of you in this group have diabetes. I talked to my Aunt Dale about you guys, and it sounds like most of you have type 2 diabetes, meaning that you acquired diabetes later in life as an adult versus as a child. And what I thought we would talk about today is low blood sugar. So first we're going to just talk about what low blood sugar is. I'm sure a lot of you have experienced that. And you'll hear doctors throw around terms. They'll say hypoglycemia, hyperglycemia, but what we're talking about is hypoglycemia. And the way I tell my patients how to remember that is low hypo. So it rhymes. And so that distinguishes it from hyperglycemia, which is high blood sugar. But this is hypo, low, and that's what we're going to talk about today, okay? The official definition of low blood sugar or hypoglycemia is less than 70. Now, some of you that have had diabetes for a long time, whether you were diagnosed or not and whether you knew it or not, some of you will feel the symptoms of low blood sugar at much higher levels than less than 70. All of us, just about when we get less than 70, most of us will start feeling some sort of symptoms. But some of you will feel it at much higher numbers. I've had some patients, and whenever they drop less than 150, they start getting some symptoms. And that, if that's the case, that requires some working with them and with their medications to kind of slowly make their blood sugar come down to a normal level. But most of you, sorry, I had an alert. Most of you will definitely feel bad if it gets less than 70. So the cool thing about our body is we are designed with a warning system. So just like if our car gets low on gas or oil, we have these lights that ding and, hey, we need to fix something. Or if we have a security system on our house or where we live and somebody tries to break in, there's alarms. Very similarly, your body was designed with an alarm system because your brain needs some sugar to function. We have to have sugar to run all the other systems of our body because our brain is our computer. And so if our sugar gets low, our whole body's out of whack. And so because of that, you were designed with this warning system that says, hey, warning, warning, something's not right. You need to fix it. You need to get sugar in your body. And that's what we're going to talk about today is first, what are those warning systems? Because everybody's warning systems are a little bit different, and you may know the common ones or you may know what you feel like, but if you guys learn all of the signs of low blood sugar, then you can watch out for your friend who's in this group that may have a little bit different symptoms. So it's kind of exciting that you guys can develop this team so that you can watch out for each other. And if something's going on, you can say, hey, let's go check Miss Betty's blood sugar or whoever it happens to be. So the first one that's pretty obvious, you guys will have probably all experienced this if you've had low blood sugar, is you feel shaky. So you have a tremor. You just feel like, oh, I'm feeling a little shaky. I'm not feeling quite right now. That's a very, very common one, feeling shaky. Along with that is feeling nervous or anxious, and you don't have a reason to feel nervous or anxious. There's nothing you're necessarily worried about at the time, but you're feeling that way. Your body is saying, "Hey, you need to be nervous about something. You need to get some sugar or carbs in your body right now to feed our brain." And your body will kind of alert you by being nervous. Others are sweating, chills, clamminess. You just kind of feel hot, or your skin's clammy, and the temperature's fine. You were cold 10 minutes ago, but now you just feel a little clammy, and that can be also from your sugar dropping. If you are irritable and impatient all of a sudden, along with hunger, people nowadays, when they call it they're hungry and they're angry, they call it hangry. They kind of shove those two words into one. Well, sometimes people get very hangry when their sugar drops. That kind of happens to all of us. But when your sugar's really, really low, all of a sudden, you just need food, and you're going to be angry and impatient until you get it. Confusion is one symptom that is real. This is a really, really good one to watch out for each other. So if you're talking to your friends in the group and they are talking normally and they're talking about their grandkids or their great grandkids, or they're talking about what activity they're going to do next, and everything's making sense, and then all of a sudden they're not making much sense, and their words aren't matching up right, and they were making sense 10 minutes ago, then all of a sudden you might think, "Hey, let's go check Mr. Joe's sugar, because I'm thinking something's maybe not quite right." Okay. So that would be a time to alert a staff and just say, "Hey, let's maybe check his sugar, because he's a little confused." Fast heartbeat. Along with feeling anxious and nervous and shaky, you feel your heart kind of pounding. And again, that's your body trying to compensate for that low blood sugar. Let's get what sugar we do have. Let's get it to all the systems so that we can function. It's your body just trying to keep up with the low sugar that it's running on. So again, this is a good system. It's what God put in place for us so that we will be able to function correctly. Another one is feeling lightheaded or dizzy. You just all of a sudden feel a little woozy, a little lightheaded, and it just hits you all of a sudden, especially along with these other symptoms. That could be also a symptom of low blood sugar. We talked about hunger, nausea. You feel a little sick on your stomach, feel like you might want to throw up. That could also be a symptom of low blood sugar sometimes. Now, this next one is good for you guys to watch out for each other, because you may not necessarily notice this one. It's pallor, which means color is draining from your skin. So you're talking to your friend and he looks normal, or she looks pink-cheeked and normal, like she is doing, and then all of a sudden you feel I'm sorry, I got a message and I was reading that at the same time. I apologize. I'm losing my train of thought. All of a sudden they look white, and they look a little just washed out. That could be a sign of low blood sugar. Feeling sleepy. Somebody is talking to you. It's not their nap time. It's not their bedtime. And normally they're just kind of, or all of a sudden they're just kind of falling asleep on you. And they don't normally do that. Again, some of these things, if it's the normal for your friend to fall asleep when he's still, I do that sometimes, then you don't have to all assume everything's low blood sugar. But if something's out of the ordinary for someone, they're normally perky and they're normally awake at this time of day, and then all of a sudden they're feeling sleepy, might be a sign that you need to go check their blood sugar. Also feeling weak or having no energy, that's out of the normal, again, because a lot of us, as we age, we might already feel weak and like we have no energy. But if all of a sudden you're feeling weak and having no energy when you normally do, then it could be a sign of low blood sugar. Blurred or impaired vision. So any change in blood sugar, whether suddenly going up or suddenly going down, can cause a change in your vision. So if you're all of a sudden blurry, then that could be up or down, that your sugar has changed. Headache. All of a sudden you get a headache. That might be a sign to go ahead and check your sugar. Tingling or numbness in your cheeks or your tongue or your lips. That could be also your sugar dropping all of a sudden. Coordination problems. You're clumsy. You're dropping everything all of a sudden. You're not able to button things all of a sudden. Your feet won't quite go one in front of the other like they normally have been if you're able to walk normally in normal times. And then if it's a sudden change, that can be low blood sugar. Again, this is one you want to watch out for your fellow group member, but slurred speech. So you're talking to your friend and everything's going along normally, and then they start kind of sounding a little bit drunk and a little bit slow, and they don't normally sound like that. Then that's the time to alert staff and say, hey, let's check this person's sugar because I think their sugar might be getting a little low. Now, a couple of these can also be signs of stroke, like coordination and slurred speech and dizziness. So if it's not sugar and their sugar's okay, then we need to really maybe alert the nurse about some of these things, because a couple of these things have overlapping things that could be the cause. But I do want you to know all of the ones that can cause low blood sugar. And then one of the last ones is a severe one, and everybody's going to know that that's a problem, is seizures. We don't expect you to have seizures, but if your sugar gets really, really, really low, your brain can't function. And so hopefully you guys will never have that, but just kind of giving you a complete list of everything that can happen with your sugar dropping low. And the only way to know for sure if it is your sugar that's dropped low is to check your sugar. So if there's any question about it, or I'm wondering if this is from sugar, go ahead and check your sugar. I know some of you are probably control your sugar by food, some with medications that you take by mouth, and some with insulin, or a combination of all those. And hopefully you guys have plenty of strips and access to strips and that sort of thing. If not, talk to your doctor about that, because Medicare usually covers strips pretty well. So that would be something to make sure you have plenty of strips so that you're able to check your sugar regularly. Okay. So the next thing we want to talk about is you are having low blood sugar, or your friend is having low blood sugar. What do we do? And what they have named this treatment is the 15-15 rule, so that you have in your head 15-15. The reason they've done this is a lot of people their sugar drops and they way overdo it. You eat, a banana, a muffin, a glass of orange juice, a donut, a piece of pizza, and a hamburger because you just so badly want to hurry up and get that feeling done with it. You overshoot, and then your sugar's 300 later on down the road. So the important thing is that we do 15 grams of carbohydrates to raise your blood sugar, and then check your blood sugar in 15 minutes. So I'll say that again. If your sugar is low, you're below 70, okay? You check it, it's 50. Then what you're going to do is do 15 grams of carbohydrates, which I'll talk in just a second about what that is, and then wait till 15 minutes and check your sugar. So it's called the 15-15. 15 grams of carbohydrates, wait 15 minutes, check your sugar again. Okay, so let's talk about what is 15 grams of carbohydrates. How am I supposed to know what that is? We'll talk exactly about what that is, okay? So I want you guys, that if you have low blood sugar, to carry around something with you so that you'll be able to remedy this, and you'll know exactly what, after this, hopefully, you know exactly what the 15-15 rule is and how much 15 grams of carbohydrates is. So one really easy thing that sometimes people will do, if you want to talk your family members about buying this, is little glucose tablets. You can buy them at your local drugstore, your local Rite Aid, or Walgreens, or CVS, or whatever you guys have in that area. They look like little tablets, and they're chewable, and you eat 3 of them. And 3 glucose tablets is 15 grams of carbohydrates. And it's very easily measured out. So your blood sugar drops low, you pop 3 of those in your mouth, chew them, wait 15 minutes, and check again, okay? So that's one thing. Another thing is a gel tube. and you look at the instructions on the tube, but usually they can come in like little tubes, and you just squirt all of that in your mouth. It's quick sugar, and that's a pretty easy way to get your sugar also. So that's something to talk about your family if you're interested in that, is a glucose gel. Now, let's talk about the easy things. That if you don't have the glucose tablets and you don't have the glucose gel, what do I have around me that I can use to exactly raise my sugar using 15 grams of carbohydrates? What's that going to look like? Okay, the first is 4 ounces of regular soda or juice. So, I say regular soda, not diet soda. So if you normally drink Diet Dr. Pepper, Diet Mountain Dew, Diet Pepsi, whatever you drink, don't use that to treat your low blood sugar because it doesn't have sugar in it. It's not going to help. But when you're going to treat with regular soda, you're only going to use 4 ounces. Okay, so most juice glasses are about 8 ounces. So 4 ounces is a lot less than you think. A can of Coke is 12 ounces. So we're talking about only a third of it. If you have a bottle of Coke, that's about 20 ounces. So again, this is only going to be a fifth of it, of a bottle, and a third of a can of Coke. So if you drink a whole bunch of, if you drink a whole can of Coke, you've had 45 grams of carbohydrate instead of 15. So we're only talking about 4 ounces, which is about a third of a can of regular Pepsi, regular Dr. Pepper, regular Mountain Dew, or regular orange juice, or grape juice, or apple juice. We're only talking about 4 ounces in a cup, which is not really that much. Again, you don't want to overshoot, because if you overshoot, you're going to have the problem where your sugar is going to be really, really high, and you're going to have the opposite problem of high blood sugar by treating your low blood sugar. Okay, another is if you don't have any soda or juice around, you can do 1 tablespoon of sugar, just regular sugar, 1 tablespoon of honey, 1 tablespoon of corn syrup. So that's 1 tablespoon of sugar, honey, or corn syrup. And that's good for the staff to know, because that's probably really easy to find in your kitchen, right? So again, that's 4 ounces of juice or soda, or 1 tablespoon of sugar, 1 tablespoon of honey, 1 tablespoon of corn syrup. Okay, let's talk about the things that you could carry around that you would have just in case. Lifesavers. Those little hard candies with the hole in the middle, the colorful ones. If you do 6 Lifesavers, that is 15 grams of carbohydrates. So just remember 6. You could even put 6 in a little baggie or 6 in a little bag and keep them with you. And if you drop, okay, this is my 15 grams of carbohydrates. I'm going to eat 6 of them, but I'm not going to eat 3 rolls of them, because then my sugar is going to be really high. Another thing is 6 to 7 regular size jelly beans. That will also work. So if you prefer jelly beans as your treatment, again, you could just kind of measure those out, have those with you. And if your sugar drops, 6 to 7 jelly beans, that'll bring it up. Gumdrops. Let's talk about gumdrops. 7. 7's the number for gumdrops. So again, you can measure those out, have those ready. That's your 15 grams of carbohydrates. If there's any other sugary food, you can kind of look at the label and try to figure out. But those are just some easy ones. Soda, juice, hard candy. And then if your family wants to buy the glucose tablets or the glucose gel, then that'll work too. Okay. Things not to use to treat your blood sugar. Again, no diet drinks, because it's not going to help. And then nothing with a lot of fat. So some people will want to treat their low blood sugar with chocolate bars, but the chocolate has fat in it. So because it has fat, it's not going to absorb quite as quickly. And so no chocolate. Let's just do the straight up, just simple sugar candy and not chocolate, because it's not going to work quite as well. Okay. All right, so I'll just mention it, but for our very severe hypoglycemic people, you probably have been working with your doctor, but there's actually kind of a shot called glucagon that somebody can jam into your thigh or your rear or your arm, and it gives you, if you're not able to drink anything or eat anything, that is something that someone can give you to all of a sudden break down your stored sugar and give you an instant burst of sugar. If for some reason you have very severe low blood sugar and you've passed out before, or it's a very common thing for you to not be able to drink or eat on your own, then talk to your doctor about getting glucagon. Hopefully that's not your case. If it is and you have any more questions about that, you can send a message or question through Dale Smith, and I'll be glad to answer anything I can. But the most important thing would be to talk to your doctor about that. All right, let me see where I am. Okay, so if your friend is having low blood sugar, and they are not able to treat themselves, they are passed out, then obviously I think probably most of you know, don't give them insulin. I know that sounds silly to say, but people that don't, you guys know about diabetes because you have diabetes, but your friends that don't know about diabetes, make sure they know that you don't get insulin if you've passed out. Because people will assume, oh, well, insulin is for people with diabetes. So if they have passed out, that means they need more insulin. And I can kind of see why they would think that. But of course, it's going to make your problem worse and make your sugar lower. And that has happened, and it's very dangerous. So make sure your friends and your family and anybody around you know, hey, if you find me laying on my floor and you think I have low blood sugar, please don't give me insulin. That is the opposite that I need. So make sure they know that. Also, do not try to provide food or fluids to someone that is not awake if they're not able to swallow because they can choke. So that also has been bad things that can happen, and you need to try to make sure that your family member knows that, or your friends there at Brookdale. Okay, so one of the most important things is if you are getting low blood sugar, of course, telling you how to treat it and how to take care of it. But one of the most important things is to try to figure out the reason it dropped in the first place. If this is something that's happening often or frequently, you need to talk to your doctor and try to figure out why that's happening so that we can maybe change things and hopefully it won't happen as much. But one thing is your medication. You might be on too much medication. If you might, some of you are on insulin and some of you are on medications that you take by mouth. Either one of them can drop your sugar sometimes where we just have you on too much. And so if it's happening where, every day at this time, my sugar's dropping every single day, predictably, they need to back off your medication. So tell your doctor, if your sugar is regularly dropping, try to see if you can figure out a pattern, get someone else to try to help you figure out a pattern, and then tell your doctor, okay, every day at 3 o'clock, my sugar's dropping, and they can figure out, okay, well, this medicine that we're giving them at this time, that's too much, and we're going to back off a little bit. Other thing is if it's happening just occasionally, to think about what was different in my day, like your food. Did I skip a meal? Was I, I took my medication, but I skipped a meal? That could be something that happened, and that's easily remedied, right? If you skipped a meal and your sugar dropped, then well, next time I'm not going to skip a meal. I'm going to make sure I get my meals on time. Okay. Another one is, say you have started a new exercise program and you used to not walk every day, but now every single day you're getting 20 minutes of walking, and then right after you walk, your sugar drops and you have to treat your sugar. Well, because your physical activity has changed, then that's kind of acted like medicine for you. And again, you may not need as much medicine. And so they might be able to drop your medication a little bit, or they might tell you to eat a very small snack, not to overdo it, but a very small snack before you exercise. That might be something that they do also. All right. Many people with diabetes, especially those who use insulin, should really have a medical ID with them. So if you don't, I would just encourage you to talk to your family members about helping you get one of those. There are all kinds of different things that are available, but there's necklaces, there are bracelets, there's all kinds of different things, and it's gonna, have your name, your address, and it'll say that you have diabetes. And the good thing about that is real quickly, they can check your sugar. You know, if they know you have diabetes, they can check your sugar and get you remedied quickly, you know, instead of, well, it could be this and this and this could be heart attack. And they're, you know, at least first, okay, this person's diabetic, let's check their sugar. And so that's very good to have. There's also even real fancy things that you can hang around your neck that has like a little zip drive, which is something that you can put in a computer that has all your medical records on it. So there's all kinds of things that you can look into, but at the very least, I would encourage you to have a necklace or a bracelet with your name and say if you have diabetes, okay? And if there's something else you have, you can put that on there too. Like if you're on blood thinner or you have a heart condition or something like that, or you have a pacemaker or you have an implantable defibrillator or something like that, you can put that on there. So these will be things that would be good for them to know. Okay, now most people are going to feel it when your sugar is less than 70, but we have rare people that they don't know. They don't feel any symptoms when their sugar is less than 70. And it's a lot of times people that have had diabetes for a really, really long time, type 2 diabetes, or they really tightly control their diabetes, and they've had lots and lots of low blood sugar in the past. So basically, you've kind of stopped sensing that low blood sugar. So that can be a little tricky. And if you think you are dropping with your blood sugar, but you are not feeling the symptoms, talk to your doctor and let them know that. The best way to know is monitoring your blood sugar pretty frequently just to make sure. All right, how to prevent, we're almost done, so hopefully I've not gone too long, but how to prevent low blood sugar is check your sugar as often as your strips and your fingers will allow. So you can check before and after meals, you can check before and after exercise, you can check before bed. If you've had a really, really hard day and a lot more exercise than you normally do, some people even check in the middle of the night. So the more information that you have and the more numbers you have to give to your doctor, the better they'll know what dose of your medications to be on. So I love it when somebody comes to me and they have a full, either their monitor, they give me their monitor and it has the date and time correct and I can see all of their numbers, or they give me a log that they filled out or a notebook that they filled out and they have lots of numbers and lots of different times. Then that really helps me to be able to figure out how much medication they should be on. All right, so that is about it. I think that's probably all of our time today. This is our first video and we hope to have more. So you please let my Aunt Dale Smith, know what kinds of things that you would like to hear about, what kinds of questions you have. If you have a specific question, give me through her your name and your question and I'll answer it. And so hopefully I can get to know you a little bit and you can get to know me, and we can kind of work like that. So just let me know. Also let me know if something's wrong with the video. I talk too slow, I talk too fast, I'm too quiet, the lighting's not good. Let me know anything like that because this is my first time and it may not be good for y'all. So just let me know if there's anything we need to change, and I hope you all have a great day and thanks for listening.